Before we get to our panel, we have two more speakers, one of which is coming up next is Ms. Quita Highsmith, who's the Vice President and Chief Diversity Officer at Genentech, a member of the Roche Group. Ms. Highsmith, thank you for joining.
Thank you so much. And let's keep the discussion going on research that Dr. Flatt started. Clinical research is not benefiting all groups equally. In 2017, a colleague and myself started at Genentech advancing inclusive research. And in 2017, when we looked at the GWAS data, the genome-wide sequencing data, it was 88% of the genomic material available to scientists were people of European ancestry. Fast forward to 2022. I just looked at the year-end data of the GWAS data. It has now gotten even more white, with 91% of the genomic material available to scientists of European ancestry. We're going to talk about why that is important, why it's not going to be helpful, and why health equity and disparities in care may get worse. We all know that just like with the LGBTQ population, Black and Hispanic Latinx populations are underrepresented in clinical research, with Hispanics being 1% and African Americans being only 5%. But here's the rub. They want to participate in research, but we have to be trustworthy and not put the blame on patients of color for not wanting to participate. But what can we do? How can we earn people's trust? The other thing is they're not asked to participate in the research. So if you're not asked, then you don't have a chance to participate. One of the things that we know that drives participation is if we have physicians and scientists that are Black or Hispanic, and what we see, and the data shows that the needle actually hasn't moved for Black physicians for over 120 years. And it's really an opportunity for us to think about how we encourage the next generation to become a physician or a scientist. Next slide. And why is that artificial intelligence? Why am I bringing that up? Because what we see is millions of Black people are affected by racial bias in healthcare algorithms. So when we talk about disparities of care, the new models that are going to be available to us, personalized medicine, it may actually make health disparities worse. When we look at artificial intelligence, it can demonstrate biological differences between Black and white prostate cancers, and it has the opportunity to yield improved care. But if these tools do not have more diversity in the data, then we could actually be making things worse. And I will end with my last slide. And I had a chance to meet Mae Jemison, the first Black female astronaut in outer space. And one of the quotes that stuck with me is she said, "The future never just happened. It was created." And we have to create a new future, one that is inclusive, one that is thinking about clinical research and how it can benefit all patients. And I look forward to the conversation.
Thank you, Ms. Highsmith. Again, another really powerful quote to end on, and I'm so excited to have you join on our panel discussion later.